ပါရှင်။ Phone Ahead တော့အစီအစဉ်ကနေကြိုဆိုလိုက်ပါတယ်။ဒီအစီအစဉ်ကဆိုလို့ရှိရင်တော့နိုင်ငံတကာကဒါပြည်တွင်းပြည်ပဆရာဝန်ကြီးတွေနဲ့တွေ့ဆုံပြီးတော့မှကျန်းမာရေးအတွက်တည်ထိုက်တဲ့ယောဂအကြောင်းတွေကုသမှုအကြောင်းတွေကာကွယ်ရမယ့်အကြောင်းတွေကိုထုတ်လွှင့်ပေးနေတဲ့အစီအစဉ်ပဲဖြစ်ပါတယ်။ဒီနေ့အစီအစဉ်မှာဆိုလို့ရှိရင်တော့အိန္ဒိယနိုင်ငံကဒီအထူးကုဆရာဝန်ကြီးဖြစ်တဲ့ဒေါက်တာကာရင်ကနေပြီးတော့မှရင်သားကင်ဆာနဲ့ပတ်သက်တဲ့အကြောင်းတွေဘယ်လိုကုသရမယ်ဘယ်လိုကာကွယ်ရမယ်ဆိုတဲ့အကြောင်းတွေကိုတင်ဆက်ပေးသွားမှာပါ။ဒီနေ့အစီအစဉ်မှာဆိုလို့ရှိရင်တော့ဒေါက်တာကာရန်မစ္စတာဂျိန်းနဲ့ကျမရမင်းတို့ကနေပြီးတော့ဒီအစီအစဉ်လေးကိုတာဝန်ယူပြီးတော့တင်ဆက်ပေးသွားမှာပဲဖြစ်ပါတယ်။ကြည့်ရှုနေနေမှာပရိသတ်တွေကလည်းသိကျင်တဲ့မေးခွန်းတွေရှိလို့ရှိရင်အခုဒီဗီဒီယိုလေးပေါ့နော်ဒီ link လေးရဲ့အောက်မှာ comment မှန်ပြီးတော့မေးမြန်းနိုင်ပါတယ်ရှင်။
Hi.
Hello, Doctor. Yeah.
Good morning. Good morning, Doctor. Good morning, Yaman.
Good morning.
I'm Rabindra Jain and welcome today for our health talk. And today we are using the technology. I'm sitting in Myanmar and Doctor sitting in India. And today we will going to talk about that breast cancer. What is the cause? What is the care, the cure, and what are the prevention? And so I'm very happy to welcome Dr. From SCG Oncology Hospital, Calcutta. And so now we will start. And today, for me, we have our product executive of 4-hour consultancy, Josusin. She will help us to do the translation. So, Doctor, welcome. And
Hello.
we will start now.
Good morning, everyone.
Good morning. We will start. And today,
should we start?
Yeah, you can start now.
Should we start?
Yes.
Hello, good morning. I am Dr. Karan Sehgal. Greetings from me and my hospital at SCG Eco Cancer Center, Kolkata. We have come here today to discuss something about breast cancer. Breast cancer is a very common cancer in Southwest Asia. And if you believe the new statistics, every 10th woman in India will have a breast cancer. This is what statistics is telling, not me. So let us start how it works. Cancer is a problem. Yeah. Can we go to the first slide?
Yeah. Okay.
Can we go to the first slide?
Sorry, sir.
Can we go to the first slide? First slide. Yeah. So, likewise, it's mentioned in the slide as well. Globally, it has been increasing steeply from 2000 to 2005, and it's quite a common problem in both developing and developed countries as well. Next slide. The most important thing which we all need to know is how do we screen for breast cancer. As I told you earlier as well, it's a very common cancer, and among female, it's the second most common cancer. The most important thing which everybody needs to know about examination of breast is self-breast examination. I will tell you what self-breast examination is and how it is done. And another modality of imaging, which is mammography. So I will tell you mammography to be done in what age and among what is the high risk groups in which we have to do. Next slide. Yeah. So what are the high risk groups of breast cancer? Generally, it's seen among women more than 45 years of age. Does not mean that it does not happen in young age females. Nowadays, we have been seeing a lot of young females in their early 20s also getting breast cancer. The most common and the most important factor is a family history. If a female has breast cancer, her children, her daughters have 3 times more risk than the population risk. That means, likewise, I told you, every 10th woman will have breast cancer according to the statistics. But in a family, in a daughter whose mother has a breast cancer, that risk increase even more, 3 times more than the population risk. Another factor is first childbirth after 30 years. So late first child is again a risk factor.
Doctor,
Nulliparous
you
women.
speak
Yeah.
slowly. She need to translate, na?
Yeah. Sorry. Yeah.
Yeah. So now you translate.
So should I start again? Yeah. So translator will translate. Sorry. So we will go ahead with that. High risk group of carcinoma breast is the age group of women above than 40 years. But it does not mean that it does not happen in young females. Even in 20 years of female, there is breast cancer.
ဟုတ်ကဲ့ဒီနေ့မှာတော့ရင်သားခင်စာပဲရှင်ဒီမှာဖြစ်များလဲဆိုတာကိုပြပြပေးမှာဖြစ်ပါတယ်။များသောအားဖြင့်တော့အသက်40ကျော်တဲ့အမျိုးသမီးတွေပြီးတော့ family history မှာကင်ဆာရှိတဲ့သူတွေအသက်30ကျော်မှာပထမဆုံးကလေးမွေးတဲ့အမျိုးသမီးတွေပြီးတော့ newly porous လို့ခေါ်တဲ့ကလေးမမွေးနိုင်တဲ့အမျိုးသမီးတွေပြီးတော့ရာသီစောလာတဲ့အမျိုးသမီးတွေနဲ့သွေးဆုံးခိုင်တာနောက်ကျတဲ့အမျိုးသမီးတွေမှာအဖြစ်များပါတယ်။ Yes, sir, you can.
So, like I told, family history is most important. If a woman has breast cancer, her daughter will have 3 times more risk of getting breast cancer than the population risk. Likewise, I told that every 10th woman in India might be having breast cancer according to the statistics. So, in that patient, her daughter has 3 times more risk.
ရင်သားခင်စာတော့ဒီ developing country မှာအဖြစ်များတယ်ပေါ့နော်။ Asia မှာလည်းအဖြစ်များပါတယ်။ဟုတ်ကဲ့ So you can go.
Yeah. So first childbirth after 30 years of age, that means late first child is again a risk of breast cancer. Women who do not have any children, they have a high risk of breast cancer. Okay. So next is the benefits of early detection of breast. What is early detection of breast? So if we detect breast cancer at a very early stage, there is a lot of benefits. First of all is increased probability of survival.
ရင်သားခင်စာကိုစောပြီးတော့သိရှိခြင်းရဲ့အကျိုးကျေးဇူးတွေကတော့ဘာလဲဆိုတော့အသက်ရှင်နှုန်းကိုမြင့်မားစေတယ်။ Yes, sir, you can go.
Yeah. So you must have heard that women getting breast cancer have to get their breasts removed. Well, nowadays we have newer techniques of breast conservation. We do not need, if it is detected in an early stage, we do not need to remove the whole of breast. We can save your breast and take out only the tumor. There are newer techniques which are very helpful.
ဟုတ်ကဲ့ breast cancer ရှိနေပြီဆိုလို့ရှိရင်တစ်ခုလုံးခွဲထုတ်ရတာမဟုတ်ဘဲနဲ့ cancer ချိတ်ကိုပဲခွဲထုတ်ရတာမျိုးလည်းလုပ်နိုင်ပါတယ်
There is also less probability of recurrence. In cancer, we are always scared that the disease will recur and we are always checking for recurrence. So in early breast cancers, like when the lump is small, when it is detected in an early stage, there is low probability of recurrence as well.
ဒီပြန်လေးဖြစ်ပွားနှုန်းကိုလည်းလျှော့ချနိုင်ပါတယ်
Next slide. So let us come to the imaging. How do we diagnose breast cancer? So the most important technique is the mammography. You can see the images. Go to the back slide. Slides are moving on its own. Yeah. Next slide. Yeah. Next slide. Next slide. Yeah. Wait. Okay. So, like I was telling, what is mammogram? Mammogram is nothing but an X-ray of your breast, which is done by a special machine, that is a mammography machine. Mammogram is taken. Mammogram is a digital mammogram in which we detect the small lesions. Whenever there are small lumps in the breast, we do a mammogram.
mammography ဆိုတာတော့အချိန်မှာပဲလက်နိုင်လိုက်တာဖြစ်ပါတယ်
So when do we do mammogram? Generally, mammogram is done in women more than 40 years of age.
Yes, sir. You can do that.
Yeah. So we try to avoid mammogram in women less than 20 years of age.
Mammography ကိုပဲဒီမှာမြတ်တက်ပုံလဲဆိုတော့အသက်20အောက်လူသမီးတွေမြတ်တက်ပါဘူး
So this is an image of breast surgery. Likewise, I was telling you breast conservative surgery. We don't need to take out the whole breast. We just take with the newer techniques. We try to save the breast and take out only the tumor, and axilla is cleared. Axilla is, which is underarms, we clear the gland as well.
Yes အခုပြထားတဲ့ပုံကတော့ဒီ breast တစ်ခုလုံးကိုခွဲထုတ်လိုက်တာမဟုတ်ဘဲနဲ့ဒီမှာအကျိတ်ကိုပဲခွဲထုတ်လိုက်တဲ့ပုံလေးပဲဖြစ်ပါတယ်
So according to the current scenario, likewise, I was telling, according to the list studies, less than 3% of women are regularly screened, and high risk groups are 43 to 46 years of age.
India နဲ့ developing country မှာဆိုလို့ရှိရင် 3% တော့လူသမီးတွေကကင်ဆာရှိမရှိကို regular check up လုပ်ကြပါတယ်အများစုကတော့43နှစ်ကနေ46နှစ်အတွင်းမှာရှိတဲ့လူသမီးတွေအဖြစ်များပါတယ်
Next slide. So, what are the breast cancer treatments? Can you go back to the slides which were telling the causes of breast cancers? Back. Causes, yeah. Back. Okay. Next slide. Go front. Yeah, just here. So
this place because you are going
self,
to speak.
there must be a slide of self breast examination. Self breast examination
She
slide.
can do translation from here because she is not able to coordinate with doctor.
So we take place.
You sit here, I will sit here. You just wait when last will come, then I will ask.
Okay.
Next slide.
Okay.
Next slide. Next slide.
Hello. Yeah, Dr. Jasprit.
Yes. Yeah.
So now which slide you are looking?
Self breast examination. There will be a diagram of women. Next. Next. Okay, I think that slide is misplaced, so we can go back to the surgeries. I will tell you what is self breast examination. Go back. Yeah, go back.
Surgery. This one.
Yeah, no, go back.
This is.
Go back. Yeah. Go back. Yeah. Next. You go 2 slides. Next. No, front. You're going too much back. Yeah, next. Yeah, keep it here. Okay. So I have to stop.
Yeah. Okay, now we speak.
So we have to. Yeah. We have to talk about a very important thing which I had told earlier as well. That is self breast examination.
Zoo, you translate now. Josu,
Self
translate.
breast examination.
ကဲအခုမှာတော့ self breast examination လို့ခေါ်တဲ့ရင်သားအကျိတ်ရှိမရှိကိုကိုယ့်အကိုစမ်းသပ်တဲ့နည်းလမ်းကိုပြောပြပေးမှာဖြစ်ပါတယ် Yes sir, you can go sir.
Since I told you that something which is very important, that is self breast examination, which has to be done by women. first question is, who needs to do self-breast examination? All women above the age of 40, it is mandatory to do self-breast examination.
Karan ဆက်စီမီလို့ခေါ်တယ်ဒီ separate examination အကြောင်းကိုလိုအပ်နေတဲ့လူတွေအတွက်ပြပြပေးမှာဖြစ်ပါတယ်ဟုတ်ကဲ့ဆရာဆက် you can go sir.
Yeah. So when to do self-breast examination? Ideally, self-breast examination is to be done after 2-3 days of the last day of your cycle. That means when the periods are finished, after 2-3 days, you do self-breast examination.
Sorry sir, can you say again? Can you say
After
again?
2-3 days, when the periods finishes, after that 2 to 3 days after 2 to 3 days of finishing of your periods, self-breast examination. When to do?
1 to 2
That
days
means-
or
When to do self-breast
so
examination?
just doctor, I will tell her the self-breast examination need to do after the menstruation cycle complete.
ရာသီ
2
လာ
to
ပြီး
3 days
အချိန်
after
တစ်ရက် menstruation right
2 to 3
Yeah.
days after self-breast.
ဒီ breast separate examination ကိုပဲအချိန်မှာလုပ်တင်လဲဆိုတော့ရာသီဆက်ဝင်ပြီးရဲ့အချိန်2ရက်3ရက်အတွင်းမှာကိုပါလို့စမ်းကြည့်လို့ရပါတယ် Can you the
So how-
rules and regulation or the separate examination can you tell
Yes.
how to know the
Yeah. So how to do self-breast examination? After your period finishes, from there, after 2 to 3 days, you do self-breast examination. How to do? First of all, a woman has to do self-breast examination by herself on her own breast. She will go stand in front of the mirror with her breasts exposed in front of the mirror. She will keep one hand behind her head, and with the other hand, she will examine her breast for any lumps or bumps in the breast.
so what's the direction of the hand like up to down or like left to right
Like
Can
this,
you
and
say
the other
again?
hand over the breast. So she has to keep one hand behind her head and other hand on the breast and examine her breast that there is some lump or any lump is there in the breast or not.
ဟုတ်ကဲ့separate examination ကိုခေါ်တဲ့ဒီရင်သားချိတ်ရှိမရှိစမ်းတဲ့ချိန်ကကြတော့ဒီဆရာကဘယ်လိုမျိုးလုပ်ခိုင်းလဲဆိုတော့လက်တစ်ဖက်ကိုနောက်ကိုနောက်ပြန်နေထားတိုင်းထားပြီးတော့နောက်လက်တစ်ဖက်နဲ့ဒီကိုယ့်ရဲ့ရှင်သားမှာရှိမရှိကိုစမ်းသပ်နိုင်မှာဖြစ်ပါတယ်ဘယ်ချိန်မှာစမ်းသပ်ရမလဲဆိုတော့ကိုယ့်ရဲ့ menstruation cycle ပြီးတော့2ရက်3ရက်အတွင်းမှာစမ်းသပ်နိုင်ပါတယ်
Yes. So what all has to be seen? Any nipple retraction, if there is any discharge from the nipple or the nipple has gone inside. So nipple has completely gone inside and it is not coming out. That has to be checked as well.
မြန်မာပြောမယ်ဆိုနူဒီကောင်းအထဲဝင်တာဝင်တာကိုလည်းကြည့်ရမှာဖြစ်ပါတယ် so can you the syndrome or the like nipple structure if they are in the breast cancer like nipple
Sorry? Nipple
can
gone
you see
inside.
the
If the nipple has
nipple
gone inside
structure?
completely. Sorry?
Yeah, I want to know the nipple structure. If there is the breast cancer.
No. So we have to see for any lumps, any swellings in the breast, any discharge from the nipple, blood discharge, not milk. Lactating woman will be lactating. They will having, but if blood is coming, if some greenish discharge is coming, if some blackish discharge is coming, or nipple has completely gone inside, or nipple has eroded, means the skin over the nipple has completely damaged. So that time they need to see a doctor.
ဒီ breast cancer ရှိမရှိဘယ်လိုသိနိုင်မလဲဆိုတော့ဒီရှင်သားကနေသွေးထွက်လာတာပြီးတော့ရှင်သားကတိတိကျကျရောင်ရမ်းလာတာမျိုးဆိုရင် breast cancer ရှိမရှိကိုကိုကတန်ရရှိသွားတယ်ဆေးရုံဆေးခန်းတွေမှာအမြတ်သွားပြနိုင်မှာဖြစ်ပါတယ် Yes sir you can go next slide.
Yeah. So every month regularly woman has to do breast self exam. This is a very important point which I have told you. So can we go to the back slide? One slide before this. So let us come to the yes, this slide. No, next slide. Yeah, this one. So one slide before this.
Slide number 17.
Yeah, this one. Yeah, this one. So, what are the different modalities of treatment of breast cancer? There is, of course, surgery, chemotherapy, radiation therapy, and hormone therapy.
ဒီရင်သားကိစ္စကုသနိုင်တဲ့နည်းလမ်းထဲမှာဆိုရင်တော့ဒီခွဲသိပ်ကုသခြင်းဓာတုကုတုံးဓာတ်ရောင်ခြည်ကုတုံးနဲ့ဟော်မုန်းကုတုံးဆိုပြီးတော့၄မျိုးကုသနိုင်ပါတယ်
Sometimes all the modalities of treatment are required, and sometimes one modality is enough as well.
Yes sir. Next slide.
So, likewise, I was telling you about the breast conservative surgery. This is a picture of different women who have undergone breast conservative surgery. We did not have to cut whole of their breast. Likewise, it is propagated. So nowadays, in early breast cancers, in small tumors, when they are detected early, we go for breast conservative surgery.
ဒီပုံကတော့ဒီရင်သားကိုခွဲစိတ်ထားတဲ့ပုံပဲဖြစ်ပါတယ်အဓိကဒီကျူမာသေးသေးလေးပေါ့နော်အကျိတ်သေးသေးလေးကိုခွဲထုတ်ထားပြီးတော့ဒီရင်သားတစ်ဖက်လုံးဖျက်ရတာမဟုတ်ဘဲနဲ့ဒီခွဲထုတ်ထားတဲ့ຢာလေးသေးသေးလေးပဲဖြစ်ပါတယ် Yes sir, that's right.
Sometimes when go to the back slide. Yeah. So sometimes when the tumor is big, then sometimes we give chemotherapy and reduce the size of the tumor and again try to do this kind of surgery, that is breast conservative surgery, to save the breast of the female.
ဒီအကျိတ်ကကြီးမဲ့ဆိုရင်တော့ဒီ surgery လည်းမရဘဲနဲ့ဒီ radiotherapy လို့ခေါ်တဲ့ဒီဓာတ်ရောင်ခြည်ကုတုံးနေနဲ့ကုသလို့ရပါတယ်
Next slide. Next slide. So, like previous slide. Yeah. So, likewise, I was telling. Next slide. Next. Yeah. You stay here. No. One slide.
Slide
before
number
this.
19.
Yeah.
This slide,
this one,
right?
yeah. Sentinel lymph node. Yeah. So, what is sentinel lymph node biopsy? Like I was telling you, there are newer techniques to avoid the breast to be removed. Same way, in breast cancer surgery, we have to clear the gland in the underarm as well. But clearing that whole of gland sometimes have some complications, some pros and some cons. So for that, a newer technique has come, which is called sentinel lymph node biopsy.
ဒီပုံမှန်အားဖြင့်ရင်သားကင်တာရှိမရှိကို lymph node ကနေပြီးတော့သိနိုင်ပါတယ်ပုံမှန်ဖြင့် lymph node ကဒီဂျိုင်းမှာရှိတတ်တယ်ပေါ့နော်အဲဂျိုင်းမှာရှိတဲ့ lymph node ရဲ့ biopsy အသားသားယူပြီးတော့ breast cancer ရှိမရှိကိုသိရှိနိုင်မှာဖြစ်ပါတယ်
So how does this sentinel lymph node biopsy helps us? First of all, like I was telling, if the whole gland of the axilla, that is underarm, is removed, it comes with some complication. Sometimes there will be lymphoria, the hand gets swelled up like an elephant's foot. So to avoid those things, sentinel lymph node biopsy has come.
Okay အခုနပြောတဲ့အတိုင်းပဲဂျိုင်းအောက်မှာပေါ့နော်ပုံမှန်အဖြစ်ဒီ lymph node တွေကဂျိုင်းမှာရှိတတ်တယ်ပေါ့နော်ဂျိုင်းအောက်မှာရောင်ရမ်းလာတာဆိုလို့ရှိရင်ဒါက lymph node ရှိနေပြီပေါ့နော်အဲဆိုအဲ lymph node ရဲ့အသားသားကိုယူပြီးတော့ breast cancer ဟုတ်မဟုတ်ဆိုတာစစ်ဆေးနိုင်ပါတယ်
Another thing which it helps in is telling if the sentinel lymph node biopsy is negative, it helps us in telling that the patient prognosis will be good. Means the chance of survival will be more if the sentinel lymph node biopsy is negative.
Yeah, can I know like the difference between negative axillary node and positive axillary nodes? Can I know this?
Yes. Yeah. So axillary node means when we do the surgery of breast, by default we remove the gland of axilla. The whole gland, that is lymph nodes of the axilla, has to be removed. To see, because the breast cancer will first go to the axillary lymph nodes. So that means it is locally advanced breast cancer. So if those nodes are positive, So if that node is positive, that means it's an advanced stage. And if it is negative, that means it's an early stage.
Okay. It means positive mean it contain cancer and negative mean it contain like potential cancer, right?
Early cancer.
Is that right?
So
Yes, sir.
if it is negative, the axillary node is negative, that means the tumor is still in early stages and patient survival rate will be high.
Like early stage of cancer.
Sorry?
The
Yes,
early stage of cancer.
early stage of cancer. Yeah.
ဒီ lymph node ကို biopsy ယူခြင်းအပြင်ဒီ negative axillary node လား positive negative axillary node လားဆိုတာသိရှိနိုင်ပါတယ်။ဆရာပြောသွားတာက negative axillary node ဆိုတာကဒီ joint မှာရှိတယ်။ဒါပေမဲ့သူက cancer cell ကိုမှဒီအစာပိုင်းပဲရှိသေးတယ်ပေါ့နော် positive axillary node ဆိုတာကကြတော့ဒီ cancer cell တွေရှိနေပြီတော်တော်လေးပြတ်နေပြီလို့ပြောချင်တာပါ။ဟုတ် next slide.
Okay, can we go to the next slide? Yeah. So these are the indications in which sentinel lymph node biopsy has to be done. Like I told you, it's a new technique. It is only done in patients where clinically there is no palpable node. So
Yes.
this is a very important point. So in cases where already breast cancer has gone here, that means the axillary node is palpable on clinical examination. In those we don't do this test.
ဒါကတော့ဒီလူနာကိုဆန်းသတ်ထားတဲ့အခြေအနေပေါ့နော်ဒီသူက breast cancer တော့ရှိရယ်ဒီ joint မှာတော့ဒီ lymph node မရှိဘူးပေါ့နော် yes sir you can go sir that one.
So in again, likewise I was telling that in so this is just a slide to mention that how the techniques are done. It is done with a blue dye and otherwise it is done with a radionucleotide dye, nuclear medicine dye as well. So combined effect has a good positive effect, that is 95% positive values.
ဟုတ်ကဲ့ဒီ lymph node ကို lymph node မှာရှိတဲ့ cancer ကိုဒီဆွဲထုတ်တာကြတော့အဓိကအပြင်ဘာတွေလုပ်ကြလဲဆိုတော့ဒီပြန်ရည်ကြောကို mapping ချတာမျိုးပြီးတော့ blue dye နီးနဲ့ lymphoscintigraphy ဆိုပြီးတော့ဗောနော်နီလန်းနေရှိတယ် blue dye နီးကတော့ yes blue dye နီးကတော့ yes can you explain the term lymphoscintigraphy?
That is you can just tell them that it's a nuclear medicine dye. Nuclear medicine.
It's just like the finding of disease in the lymphatic system, right?
Yeah. So if it is this newer technique is done with blue dye and with the radionucleotide dye. Radionucleotide dyes are tagged dyes which are tagged with radionucleotide. So with the special gamma camera, we see that dye where is going in that node. So if it is combined blue dye and the radionucleotide dye, the success rate of finding that node is 94%. And with only blue dye, it is only 83%.
Yes, sir.
To find the node. This is to find the node. Yeah.
ဒီ blue dye နည်းနဲ့ဒီပြန်ရည်ကြောအဖွဲ့အစည်းမှာယောဂရှာခြင်းနည်းနှစ်ခုပေါင်းရင်တော့သူအောင်မြင်မှုရာခိုင်နှုန်းက 97% လောက်တော့ရှိနိုင်မယ်ပေါ့နော်ဒါပေမဲ့ကြာရှုံးတဲ့ရာခိုင်နှုန်းကတော့ 0 to 11% လောက်တော့ရှိနိုင်ပါတယ်ရှင် Yes sir, next slide.
Yeah. Next. Yeah. So different modalities of surgeries. So the first one is the classic, that is modified radical mastectomy, in which whole breast is removed. And second one, which is a newer technique, which is breast conservative surgery. That is, we don't need to remove the breast, we can save the breast. And another thing which has to be clubbed with breast conservation is reconstruction. If we try to take out the whole breast, we can still reconstruct it. So I will talk about reconstruction. First, to tell about two surgeries which I have told. The whole breast to be removed, that is this one, and next one.
Yes, please translate.
Yes sir. ဒီခွဲစိတ်ဘောနော်ရင်သားခွဲစိတ်ခြင်းမှာဆိုလို့ရှိရင်အဓိက radial mastectomy လို့ခေါ်တယ်ရှင်သားတစ်ခုလုံးကိုပေါ့နော်ဒါဓာတ်ရောင်ကြီးခုလုံးနဲ့ဖယ်ချလိုက်တာပေါ့နော်ဒါပေမဲ့ဒါကတော့နည်းနည်းရှားပါပြစ်စင်ပေါ့breast conservation လို့ခေါ်တဲ့ဒီရင်သားကိုဒီကျူမာလေးကိုပဲထုတ်တာမျိုးရှိမယ်ပြီးတော့ reconstruction လို့ခေါ်တဲ့ဒီရင်သားတစ်ဖက်လုံးဖြတ်လိုက်ရတာကိုသူ့ရဲ့ own tissue နဲ့ပဲဖြစ်ဖြစ် implant ပစ္စည်းတစ်ခုနဲ့ပဲဖြစ်ဖြစ်ပြန်ပြီးတော့ထည့်တာမျိုးလည်းဖြစ်နိုင်ပါတယ်
So let us talk about reconstruction now. So reconstruction
Yes,
is
sir.
nothing but when we remove the breast, we try to reconstruct it.
ဒီ reconstruction ဆိုတာကြတော့ဗောနော်ရင်သားတစ်ခုလုံးကိုဒီကင်ဆာဖြစ်နေတဲ့ရင်သားတစ်ခုလုံးကိုဖျက်ချလိုက်တာပဲဖြစ်ပါတယ်တစ်ခုလုံးကိုဖျက်ချလိုက်တာဖြစ်ပါတယ်
Sometimes to reconstruct the breast we take out the muscle from the back, rotate it in the front and try to make a new breast for the patient.
ဒီပုံမှန်အဖြစ်သူ့ကိုပြန်ပြီးအစားထိုးခြင်းတယ်ဆိုလို့ရှိရင်ဒီကိုယ်ရဲ့ခန္ဓာကိုယ်ကပဲဒီအသားသားတစ်ခုနဲ့ပြန်ပြီးတော့လည်းအစားထိုးနိုင်ပါတယ် Yes sir
Sometimes we try to put implant in the breast.
Yeah ဆောင်းနာပြောသလိုပဲဒီကိုယ့်ရဲ့ tissue မဟုတ်ဘူးဆိုရင်လည်းအပြင် foreign body တစ်ခုခု implant နဲ့ပြန်ပြီးတော့လည်းအစားထိုးနိုင်ပါတယ်
Yeah. Next slide.
Yes
No, go back.
Here
Go back. Go back. Go back. Yeah. So a few more techniques which I will tell you about reconstruction is oncoplasty techniques, plastic surgery techniques which we have incorporated in breast cancer to do the reconstruction.
ဒီ implant ထဲဖို့ဆိုရင်တော့ဒီပေါ့နော် plastic surgery ပုံစံမျိုးနဲ့ပြန်ပြီးတော့အစားထိုးရတာပဲဖြစ်တယ်ပေါ့နော် own tissue မဟုတ်လို့ရှိရင် implant tissue နဲ့ပြန်ပြီးတော့အစားထိုးရတာဖြစ်တယ်ဒါကို plastic surgery နည်းနဲ့လုပ်တယ်လို့ဆရာပြောပါတယ် Yes sir you can
So like I was telling you breast conservative surgery we don't need to take out the whole breast, we just take out that portion of the tumor and
Yes sir
it is reconstructed with the whole with the breast. We do something called as type 1 oncoplasty and type 2 oncoplasty to fill that gap.
Yes sir breast conservation လုပ်မယ်ဆိုရင်ကြတော့ဒီရင်သားတစ်ခုလုံးကိုဖျက်ထုတ်စရာမလိုဘဲနဲ့ပေါ့နော်အထဲမှာရှိနေတဲ့ cancer tumor လေးကိုပဲထုတ်ပြလိုက်လို့ရပါတယ်ဒီတစ်ခုလုံးဖျက်စရာမလိုပါဘူး
So these new techniques are numerous number of techniques in which we can reconstruct the breast. So nowadays the norm is if you cannot reconstruct, do not destruct or do not remove the breast. If you cannot reconstruct, do not remove the breast.
Yes sir
Reconstruction is mandatory for breast cancer.
ခုခေတ်မှာတော့ဒီတစ်ခုလုံးထုတ်စရာမလိုဘဲနဲ့ဒီအဆင့်မြင့်နည်းပညာတွေနဲ့လုပ်နိုင်နေပြီဖြစ်ပါတယ်ဒီမှာတော့Yes sir you can go
Yeah. So like I was telling you sometimes the tumor is little big in the breast and we are not able to do upfront surgery or in some cases we think that we cannot save the breast, so in that cases we try to give chemotherapy and reduce the size of the tumor.
ဒီရင်သားမှာပေါ့နော်ရောင်ရမ်းခြင်းတွေဖြစ်လာပြီအကျိတ်တွေဖြစ်လာပြီဆိုလို့ရှိရင်ကိုကဒီကင်ဆာမှန်းမသိသေးဘူးဆိုလို့ရှိရင်ဒီ radiotherapy လို့ခေါ်တဲ့ဓာတ်ရောင်ခြည်ကုထုံးလို့ chemotherapy လို့ခေါ်တဲ့ဓာတုကုထုံးလို့ ਨੇ ဒီကုသလို့ရပါတယ်
Yes. So chemotherapy can be used before the surgery in cases in which we want to save the breast. By giving chemotherapy we reduce the size of the tumor and then do the surgery, save the breast, do oncoplasty and save the breast of the woman.
chemotherapy ကတော့ဒီ surgery လုပ်ခင်မှာအသုံးပြုလေးရှိပါတယ်ပေါ့နော် So can you explain the radiotherapy rays 2D 3D IMRT
Yes, we will talk. Yeah.
Yes sir
So the next modality of treatment is radiotherapy. So in cases where we do breast conservative surgery, radiotherapy is mandatory. After serving the breast, radiotherapy is a mandatory thing which we have to give. Radiation is nothing but which burns the tissue with the radiation, burn the tumor cells with the radiation.
ဒီဓာတုဓာတ်ရောင်ခြည်ကုထုံးအနေနဲ့တော့ဒီနီလန်းအနေနဲ့ပေါ့နော်အသုံးပြုလေးရှိပါတယ် So there are so many questions in the comment can I
Yeah, first complete the presentation, then ask question.
Yes sir
Doctor, what I will suggest,
So,
now you can ask, you can answer question and answer session.
Please. So I just go skim through these radiation techniques. We can different modalities of radiotherapy, 2D, 3D, IMRT, IGRT. IMRT and IGRT are the most advanced and precise. That means only they will give radiation to tumor cells. It is very precise radiotherapy which is given.
ဒီဒါဓာတ်ရောင်ခြည်ခုတုံးမှာဆိုရင်တော့ 2D လို့ခေါ်တယ်နှစ်ဖက်မြင်ဓာတ်မှန်ရိုက်ခြင်း 3 လို့ခေါ်တယ်သုံးဖက်မြင်နှစ်ဖက်ရိုက်ခြင်းသုံးဖက်မြင်ဓာတ်မှန်ရိုက်ခြင်းပြီးတော့ IMRT IGRT နည်းရည်နဲ့ကုသလေးရှိပါတယ် IMRT IGRT နည်းရည်ကတော့သူပေါ့နော်လိုချင်တဲ့နေရာလေးကိုပဲဒီ radiation ပေးလိုက်တဲ့သဘောပါပဲ
Yeah. Next slide. Next slide. These are various machines.
Okay, this we leave it. Yeah, so I think now we will complete this presentation and we can have question answer session.
Yeah, please. I love to answer. Let us interact a bit. Yes.
Yeah, just so now you can ask question answer.
Yes, sir.
Yeah, please.
They are asking the prevention or the breast cancer. How to prevent from the breast cancer?
So, likewise, I had told you the causes of breast cancer. Prevention, as in, we can just see the high risk groups and try to see if we are falling in that high risk group. And if you are falling in that high risk group, which I was telling, can you open that slide of high risk groups so that people can see it again? First or second slide, it must be. So high risk groups, if you see they are in the high risk groups, they have to see their doctor regularly and they have to do self breast examination. So prevention, I am not very sure that how to prevent, but early detection is the best treatment for this. Go to the first or second slide, it is high risk groups.
Yes,
so there is no thing, there is no not a thing called as that by eating this cancer will happen or by eating not eating this breast cancer will not happen. But if you fall in this high risk group, we have to be very careful and we have to try to avoid these things and then we can go ahead with things like smoking needs to be avoided, high fiber, high fat and high red meat diet has to be avoided, and likewise. So if you are falling in this high risk groups, just see your doctor regularly and do self breast examination. Self breast examination is the single modality of treatment which will help you in getting early detected.
Yes, sir. ရင်နာကိစ္စမဖြစ်အောင်ကြိုတင်ကာကွယ်လို့ရတဲ့နည်းလမ်းတွေကတော့အဓိကဒီမှာပြထားတဲ့အတိုင်းပေါ့နော်ဒီအရက်သေးတာ short တောက်တာဒီဆေးလိပ် short တောက်တာပေါ်ပြီးတော့ high low fiber diet မဖြစ်စေရပါတော့ဒီအမြင့်တက်များစားတာမျိုးလုပ်သင့်ပါတယ်ပြီးတော့ early detection လို့ခေါ်တဲ့ဒီစောစီးစွာပေါ့နော်ကြိုတင်ကာကွယ်တယ်ပြီးတော့ကိုယ့်ကို self breast detection လို့ခေါ်တဲ့ဒီရင်နာကိုပေါ့နော်အမြဲကိုယ့်ကိုစမ်းသစ်နေရမယ်ပေါ့နော်အကျိတ်ရှိမရှိစမ်းသပ်ပြီးတော့အမြဲပေါ့နော်စေကန်းကိုသွားပြီးတော့ကြိုတင်ကာကွယ်သင့်ပါတယ်ရင်နာကိစ္စမဖြစ်အောင်
Yes.
Okay, next question.
So one more thing which I want to tell you is self breast examination. There are multiple videos on YouTube about self breast examination. So it is easily available. If you go on YouTube, see self breast examination. There are multiple animated videos.
Yes, sir. Yes.
Learn how to do self breast examination.
ဟုတ်ကဲ့ကိုရိုင်းရင်သားကိုပေါ့နော်အကျိတ်ရှိမရှိစမ်းသပ်ခြင်းကဒီ YouTube မှာရောတခြားမီဒီယာတွေမှာပေါ့နော်ဘယ်လိုစမ်းသပ်ရမလဲဆိုတာအလွယ်တကူသိနိုင်ရတဲ့ကြောင့်မလို့ဒီ YouTube ဖြစ်ဖြစ်တစ်ခုခုကိုကြည့်ပြီးတော့ကိုစမ်းသပ်နိုင်မယ်ပေါ့နော်ဆရာပြောတဲ့နည်းကတော့ဆွမ်းနာလက်တစ်ဖက်ကိုနောက်ကိုထားပြီးတော့ဒီ channel လက်တစ်ဖက်နဲ့ဒီစမ်းကြည့်ရဲ့နည်းပေါ့နော်အဲ့တိုင်းလုပ်လို့ရသလိုတခြားနည်းတွေရှိရင်လည်းကို self detection လုပ်ကြည့်သင့်ပါတယ် like another question is what are the high risk of breast cancer before the menopause and after the menopause, or before menopause or after menopause? What is the high risk of cancer?
So there is a hormone which is there in the body, estrogen, which when in females, it is when the breast organ is developing, their ovaries are developing, estrogen is on the higher range. In that cases, you must have seen that estrogen, there is always hormonal imbalance. So in post
Yes.
menopausal women, the estrogen is going little low. So in such cases, when estrogen is high, so that will cause all the hormonal imbalance and some lumps and bumps will happen in the body. So you tell this, then another point I will tell you.
ဒီအမျိုးသမီးတွေမှာပေါ့နော်ဒီဟော်မုန်းကအတက်အကျအမြဲဖြစ်နေရဲ့ဘယ်မှာပို့ပြီးတော့ဖြစ်များလဲဆိုတော့ဒီသွေးဆောင်ပြီးတဲ့အချိန်မှာပုံမှန်ဆိုရင်တော့ estrogen လို့ခေါ်တဲ့ဒီမိန်းမဟော်မုန်းကကျလေးရှိတယ်ပေါ့ဒါပေမဲ့အဲ့အချိန်မှာ estrogen ဟော်မုန်းကြီးအရန်တက်နေပြီးတော့ထိတွေ့မှုပိုများမယ်ဆိုရင်တော့အဲ့ဒီအချိန်မှာရင်သားကင်ဆာဖြစ်ဖို့ပိုပြီးတော့များနိုင်ပါတယ်ရှင်
So one more point which I want to clear is something called as ANDI, aberration of normal development and involution. You can write this ANDI. So this happens in ANDI, aberration of normal development and involution. People can go back and Google this. They will have a better understanding what is this term which I'm talking about. See, in females from 15 years to 40 years of age, the breast organ will be developing. How? With the hormones. In this period of time, many lumps, many swellings will come and they will dissolve on its own. Does not mean that they are breast cancers. Sometimes there will be small lumps which are developing in the body. You will see while menses or before menses, there is some lump in the breast, but after menses has stopped, that lump has disappeared. So that is not breast cancer. So that is something called as benign breast disease. That is ANDI. Aberration of normal development and involution. That also you can go Google and see.
Yes sir ဒီပုံမှန်အဖြစ်ပေါ့နော်43နှစ်နဲ့46နှစ်အတွင်းမှာဒီ breast cancer ဖြစ်နိုင်တယ်လို့ဆိုပေမဲ့လည်းအဲ့ဒီအချိန်မှာပေါ့နော်ဒီရင်သားကရောင်ရဲလာတာကြီးဖြစ်မယ်ဆိုတိုင်းလည်းဒါက breast cancer ဖြစ်တာတော့မဟုတ်ဘူးပေါ့နော်ဒီအမျိုးသမီးမှာ hormone imbalance ကအများရှိနေတဲ့အတွက်ကြောင့်မလို့ဒါက normal ပါပဲလို့ဆရာပြောချင်တာပါဟုတ်ပြီရှိတော့တယ်
Okay, till that time she is searching, doctor, I will ask you the question. What extra, why anybody should choose SCG Kolkata for breast cancer treatment?
So, like I was telling you that we've got all the newer techniques, the best of the radiation machine, which gives a very precise radiotherapy. The best of the chemotherapy is there. And of course, I am a surgeon and I'm regularly doing breast conservative surgeries. I always try to save the breast of the women. See, what was happening in earlier days was we were removing the whole of the breast. But with the newer studies, it has been proven that breast conservative surgery and modified radical mastectomy, that is removing the whole breast, has got equal prognostic value. That means there is no difference in survival between. So why not save the breast? So I always try to save the breast of the females because it requires special techniques, special dyes, and special mammography techniques. And sometimes after chemotherapy, you will see that tumor has completely dissolved. So we are doing something called as a wire-guided breast conservative surgery. That means before starting chemotherapy, we are putting a small marker inside the breast. That is a fiducial marker, which is most of the times made of gold. That stays inside the breast in the center. And later we try to localize it with the wire and take out the whole tumor around it. When after chemotherapy, the tumor has vanished. So I have done this surgery last week as well. And just now, a few minutes back, I got a call from the pathologist as well that complete response has been there. They cannot see any tumor in the removed specimen.
Josu, please translate.
Yes sir ဒီဆရာ Karan ကပေါ့နော်ဒီ ACG မှာလုပ်နေတဲ့ surgeon တယောက်ပဲဖြစ်ပါတယ်သူကအရင်ဘက်ကလည်းဒီ breast cancer ကိုပေါ့နော် chemotherapy နည်းနဲ့ကုသခဲ့တာtumor ကိုပြန်ပြီးတော့ check လုပ်ကြည့်တော့မရှိတော့ဘူးပေါ့နော်အဲ့တော့ဒီအဲ့မှာဆိုလို့ရှိရင်အဓိကသူနည်းရည်နဲ့ mammography chemography like radiography စတဲ့နည်းလမ်းတွေနဲ့ပေါ့နော်အစီအမီမြင့်ကုသပေးနိုင်တာပဲဖြစ်ပါတယ် sir can I know the course of like cancer treatment the general course
So I don't know what it will be in the Bhutanese, Burmese currency, but in INR,
Indian currency.
Yeah. So the surgery will cost you less than 2 lakhs. Within 2 lakhs, the surgery cost will be. I will have to check with because there are some rate differences for the Indian nationals and the foreign nationals. But it will be anywhere around, I think, 2.5, no, 2.5 lakhs, not more than that. And again, for radiotherapy and chemotherapy, it will be accordingly charged. For the rate,
Yes.
I think it will be a better person to check with the.
Yeah, I will tell the rate. Okay.
Yes, sir.
Rate.
Now you have any another question, or we can complete now? Okay, so Dr. in last, I want to have your takeaway conclusion of today's health talk. What you want to, what all women, those are watching our 4-hour health talk today, and what they need to do regularly so they can avoid the breast cancer. Can you give the point 5, 4, 5, 6 point?
Yeah. So the most important thing which has to be done is self-breast examination. Self-breast examination is the most important thing which you have to do. Any woman more than 40 years of age has to do self-breast examination. There are multiple YouTube videos. You can go through them. You can understand. You can learn how to do it. The only point which I want to emphasize is it has to be done, ideally done after 2-3 days of finishing your menses. Means after 2-3 days of last day of your cycle.
Yes, sir. အဓိကပေါ့နော် separate examination လို့ခေါ်တဲ့ဒီကိုယ့်ကိုရင်သားကိုပေါ့နော်အကျိတ်ရှိမရှိစမ်းသပ်ခြင်းကတော့အရေးကြီးဆုံးပါပဲအဲ့ဒါလုံးဝဒါလေကိုက breast cancer ရှိနိုင်မရှိနိုင်ဘူးတေချာသိနိုင်မှာပဲဖြစ်ပါတယ်အဲ့ကြောင့်မှကိုကြိုတင်ကာကွယ်နိုင်မှာဖြစ်ပါတယ် Yes, sir.
Second point is early detection is the way
early detection
to have a good prognostic. Yes, early detection is the most important thing. So another point is that women who have breast cancer, their daughters will have 3 times more risk of having breast cancer. So positive family history, the next in kin, they can be very careful. They can start having examination even in age of 25 years of age. But mammography has to be avoided in 25 years of age. So there is MRI breast which has to be done in young females because the breast is dense breast that time. So mammography to be avoided in young females.
mammography မှာဆိုရင်တော့ဒီအသက်ငယ်တဲ့အမျိုးသမီးတွေမစမ်းသပ်သေးဘူးပေါ့နော်ဒီအသက်20ကျော်မှာ mammography ရိုက်တင်တာပဲဖြစ်ပါတယ် Yes, sir. Can I know another question?
Yeah, please.
Yeah, if like genetic also depend on that cancer, right?
Yeah.
If the
so
mother
genetics,
have,
like I was telling, genetics.
Yes, sir. If the mother have breast cancer and then does the daughter also have the cancer, is that normal? Hello, sir.
So voice breakage is there. Can you repeat? Yeah, can you repeat? There is voice breakage.
Yes.
No.
If the mother have pregnancy and then if the possibility daughter have the breast cancer, is that like genetic?
Yes. So there is a special genetic. Yeah, it is genetic. Like that is what is family history. It is all genetics in breast cancer, and there is a special test which we can do. That is genomic test. That is gene tests in which specific genes have to be checked. BRCA1 and BRCA2. So BRCA1 and BRCA genes has to be tested in the primary case. That is the person who was detected with breast cancer. It is nothing but a blood test, which is also done at our center, and to look for specific BRCA1 and BRCA2 genes. Genetics is the most important thing in cancer. Cancer is always, most of the time, genetics related.
Yes, sir. အဓိကပေါ့နော်ဒီ family history လို့ခေါ်ရတဲ့မိသားစုထောက်ခံပေါ့နော်အမေမှာကင်ဆာရှိတယ်သမီးမှာကင်ဆာရှိနေတာဆိုအဲ့ဒါလေအဓိက separate examination နဲ့ပဲတွားရမယ်ပြီးတော့ကိုယ်မှာအကျိတ်ရှိလို့ရှိရင် biopsy ယူပြီးတော့ကင်ဆာဟုတ်မဟုတ်ကိုစစ်ဆေးတင်ပါတယ် Yes, sir.
So gene is BRCA1 BRCA2, which is detected in blood.
BRCA1,
So
yes.
this is a genetic testing which the primary case can do.
Yes ဂျင်းမှာဆိုရင် BRCA1 နဲ့ BRCA2 ဆိုပြီးတော့ပေါ့နော်သူဒီဂျင်းကိုစမ်းသပ်တဲ့နည်းလေးအနေနဲ့ဆရာပြောပြသွားတာဖြစ်ပါတယ်
Always remember the daughter will have 3 times more risk. The daughter will have 3 times more risk of having breast cancer if the mother has breast cancer. So one question I want to ask the people that does breast cancer happen in males?
Sorry sir
You can ask the public. Do they know that breast cancer can happen in males or not?
I didn't know
So
no
you
breast
ask the
cancer in
people,
male,
you
right?
ask this question, does the breast cancer happen in males? Yeah.
I don't think so sir is that real
You ask the people, you translate this, does the breast cancer happen in males? Yes, it
I'm
does.
asking to the
Even
like
males can
feedback
have. Yes, yeah, people. Yeah, please
Okay.
ask, translate this.
Say thank you, finish.
โอเคပေါ့နော်ဒီပိတ်သက်ရှိအနေနဲ့ပေါ့နော်ဒီအမျိုးသားတွေမှာရောရင်သားကင်ဆာဖြစ်နိုင်တယ်လို့ထင်ပါသလားဆရာကသိချင်ပါတယ်ပေါ့နော်အဲ့ဒါလေးတခြားတော့ comment လေးမှာရေးပေးပါအောင်ရှင်
Yes,
Yes,
the
Bobby,
breast
I don't think so.
cancer can happen in males as well. Yes, breast cancer can happen in males as well. It is very rare, but breast cancer can happen in males as well. There is an article
Yes, sir.
on with my name, male breast cancer. Yeah, there is an article with my name as male breast cancer. You can search it on Google, and you will you
Yes,
can
sir.
read about male breast cancer as well. Male breast cancer, males also can have breast cancer. It is not only in females. It is very rare, but it can happen in males as well.
yes sir.
There is an article with my name. You can search it on Google as well. Yeah.
yes sir အမျိုးသားတွေမှာလည်းပေါ့နော် breast cancer ဖြစ်နိုင်ပါတယ်ဒါကတော့တော်တော်ရှားပါတဲ့ဖြစ်စဉ်ပါတကယ်လို့ပိတ်သက်သိချင်တယ်ဆိုလို့ရှိရင်ရှာကြည့်နိုင်ပါတယ်ပေါ့နော်ဆရာအဲ့လိုမျိုးလေးပြောပါတယ်ရှင်ဟုတ်ဆရာ thank you for your time ပါဆရာ
ဟုတ်ကဲ့ပါ
Thank
ရှင်
you.
အခုဆိုလို့ရှိရင်တော့
I hope
ဒီ
the
နေ့
session was informative and helpful for people.
yes sir
ဟုတ်ကဲ့ပါ
Thank
ဒီ
you.
နေ့အတွက်ပေါ့နော်ကိုယ့်ဟက်တော့အစီအစဉ်မှာဆိုလို့ရှိရင်အိန္ဒိယနိုင်ငံကဒေါက်တာကာရန်နဲ့တွေ့ဆုံပြီးတော့မှဒီအမျိုးသမီးတွေမှာဖြစ်တဲ့ရင်သားကင်ဆာနဲ့ပတ်သက်တဲ့အကြောင်းတွေဘယ်လိုကုသမယ့်အကြောင်းဘယ်လိုကောက်ွယ်ရမယ့်အကြောင်းတွေဆိုတာတွေကိုဒီနေ့တော့တင်ဆက်ပေးခဲ့တာလည်းဖြစ်ပါတယ်ပရိသတ်ကြီးတွေဒီလိုမျိုးပေါ့နော်ဘဟုတုတရှိမဲ့အကြောင်းအရာတွေနဲ့ထောက်ပြီးတော့မှပုံမှုပြီးတော့ကျမ်းမှာပျော်ရွှင်တဲ့နေ့ရက်တွေကိုပိုင်ဆိုင်နိုင်ပါစေလို့ဒီနေ့တော့ဆုတောင်းပေးပါတယ်ရှင်ကြည့်ရှုပေးခဲ့ကြတဲ့11ရုပ်သံပရိသတ်များလို့ကျေးဇူးထူးလည်းတင်ရှိပါတယ်ရှင်
Thank you.